Dr. Nitika, last time we discussed how important it is to have those feelings, those positive things to, keep up in your mind so that, we have this notion that every single thought, every single feeling has an effect on the cell, which you said that it is really true. And ultimately, it has an effect on the fetus as well. Now I would like to know that how actually it is important to be positive even after staying in the same environment which is very stressful. How can you maintain that calmness? What are the ways with which you can actually have those positive thinking, those feel good hormones in you?
It's a very nice point. Actually, if we see every day, we do need feel good hormones to live a healthy life. We all know that. We're all exercising today. We all want to eat healthy food today. We know that we are at least aware that yes, stress is something which is going on in our mind all the time and we need to get out of it. So pregnancy brings with it a few anxieties because there is a little lack of knowledge. As I shared in the earlier episode also, once we get the knowledge, then we are very much rested. Yes, this is the thing which I am going to encounter. Like I said, that the entire pregnancy is in 3 trimesters. So every trimester it has its own unique features, characteristics, feelings, and you have to actually know them and then enjoy them. And when I mean enjoy them, if something is making you uncomfortable, then accept them, and acceptance means enjoying. Because at least you're not raising a question, why am I having this? So that even if you're unwell, you know this is going to pass. So there is where those feel good hormones come, because we have to keep aware that we need to secrete these good hormones. And how? We are not actually doing anything but to think good, but to accept things, accept work, accept pregnancy changes, accept situations around, even if they are not going to go in our, even if they're not going to be, I would say, according to what I feel is correct. Still you have to accept. So these are small little things. When patients come, couples come, we keep counseling them because they may be having difference of opinion. First and foremost, the pregnant lady is anyways more vulnerable to emotional changes. So the would-be father anyways is confused.
Right.
Because he is trying to help her, but she has her own limitations because of the mind, because of her basic, what you call basic personality traits which she is carrying, because of the changes which these hormones have induced in her. So she becomes a new person. And the would-be father anyways, he has his own things going on and they're all both settling down with each other, trying to help each other, but here is where our role as a physician comes in. That we do guide them, make them understand, and the moment they accept that these are the changes, these are the confusions, these are the problems that you are going to face, and these are the solutions to it, so it becomes easy for them. And that is the way we are going to put our thoughts to a rest. And if our thoughts are at rest, means it is not that our mind is not thinking. Mind always has to keep thinking. Right. It has to keep creating. So if we understand scientifically also, there are 3 levels at which thought works. No? One is that we have negative thoughts. One is we have useless thoughts. And one is we have necessary thoughts. So most of us are basically creating necessary thoughts and useless thoughts. Negative ones also we create, especially in this phase when we know we don't have to, not because of anything else, but because of the little fear and anxiety and the changes which our mind is not used to, as I told. So once I make them aware, we make them aware as a physician, because whatever comes out of our mouth is very, very important for the expecting parents, because they are relying totally on us when they are coming to us. So that helps them. Each and every word which we speak, each and every piece of information and knowledge which we give them, that is actually helping to make their pregnancy smoother. Not just from the physical aspect, but also from the emotional aspect. So here is where we need to give them this knowledge so that they can have a control over their thoughts, and they create those feel-good hormones, and those only reach the baby. And they will also make the same personality traits of the baby.
Really, this is really new and a very beautiful concept that apart from the physical diet, friends, we know that it is nutritious for us, we know that it is healthy for us, so we have it on daily basis. Similarly, if we start having a kind of, chapter wise routine, chapter wise emotionally
Not
healthy
even a
diet.
chapter, a paragraph will do. Even a small little paragraph every morning, we say, no, wow, it is such a beautiful morning. If I see somebody or if I meet somebody whom I like, if I meet somebody I don't like, I say, oh God, my whole day is now not going to be that great. So it's just a thought. So similarly, we don't need to read pages. Just a little good thought, and we can just keep imbibing it in our mind, keep carrying it. And I say, in pregnancy, when you get up in the morning, just get up with your baby. First, you wish good morning to your baby. Take your baby to do your daily course. The baby is there, all alive and all kicking and all ready.
I don't
Visualize.
think so that usually, parents do that, or
Because we
usually
never
mothers
tell
do.
them. We never tell them. We basically tell them, you take your medicines on time, you come for your antenatal checkups, you get all the
Before
tests
the
done.
baby is actually in their arms, I don't think so that any mother would actually, getting it. Doesn't it look very awkward that I'm, getting up and I'm just touching my belly and saying good morning?
No, it's not odd. It's the call of the day. It's actually the need of the hour. We need to connect.
Does the baby really listen to it?
Of
Does the baby
course.
respond to it?
Of course. Babies start to hear it even in the 4th month, late 4th month. And by 6th month, they have their that clarity of listening to their mother. They're listening to their mother's voice, the gurgling of the stomach. That also they can listen. The mother's voice they can listen. If the daddy is talking, they can listen. By 24th week, their senses are very, very sharp. So it's very, very clear to and most of them, they know it also, because they go through the sites, they have that knowledge that yes, sucking is going to start at 11 weeks, 10 weeks, as early as 9 weeks. Can you imagine 9 weeks you can't even see the baby? But the sucking is already there. So that means there is a face which is developing and a thumb bud is there which is sucking. So things are happening on its own. Nature is doing such a perfect job.
But we are not connecting with the things.
Because we are too busy with our own course. And actually we are busy with our course taking care of the baby also. We are having our medicines on time. We are going to our doctor for regular visits. We are following whatever advice the doctor is giving us. Because we are all concerned and we all want to work. No? Because as doctors, we also sometimes are not able to give them that detailed information. So this is what I actually feel, and it's not possible also, There is so much of rush in the clinics, patients are waiting, so we have to take care of the most important part, as is being told, physical health, and the rest of the things also they want to give it to them. So I thought it's important to just package these things now and give it to them, so that everybody can take them.
is doing it for that.
So this was the reason why I initiated this entire concept.